student ID is 2020477516.
Hello, my name is Muhammad Nirmala bin Zamri and my student matrix card number is 2020853572.
Hi, my name is Nur Hamiza bint Anwar. My student ID card number is 2020828468.
I'm Siti Zulaika binti Zulkifli. My ID number is 2020859386.
Let's talk about menopause. So today we are going to learn many things about menopause.
What is menopause? A woman's menopause occurs when she has reached the end of her menstrual cycle. In this condition, the menstrual period has been absent for 12 months and also called as amenorrhea. Biologically, menopause is a normal event. Just as the first period during puberty was the start of the reproductive years, it occurs at the end of the reproductive years. Average women reach menopause at the age of 51, but most women reach it between 45 and 55. The menopause that starts before the age of 40 is called premature menopause, and the one that starts before the age of 45 is called early menopause. The menopause process occurs over time, and it is a gradual process that is known as perimenopausal transition. Women start perimenopausal transition at different ages. Some women may also undergo oophorectomy, which is a surgery to remove the ovaries due to some reasons. This will cause immediate menopause to the woman despite the age. During the perimenopausal transition, most women begin about 4 years before their last period, but some women start 10 years before their menopause. In the perimenopausal transition, menstruation becomes irregular. During this time, the period could skip 1 month and return the following month, or even skip several months, and then resume for a few months. Also, the menstrual flow may get heavier or lighter during this time.
Start with the hypothalamus, releasing the gonadotropin-releasing hormone that stimulate the entry pituitary gland to secrete FSH and LH. Ovary respond by increasing the follicle growth. As the follicle growth, estrogen level will increase. Give the negative feedback loop that cause the FSH and LH level decrease. As the egg is ready to come out, you can see the massive peak of estrogen level that give the positive feedback loop that stimulate the entry pituitary gland to release the massive amount of LH for ovulation. Then, that follicle, after the ovulation, the follicle will turn to corpus luteum that play the roles in releasing the progesterone and estrogen. So this is how the menstrual cycle works. Next, you will see the related between the menstrual cycle and the menopause. As the estrogen level is increased or at the high level, this will inhibit the secretion of FSH. While when the estrogen level is decreased, it will release the FSH.
And now we will be proceeding into menopause. As we all know, there are roughly 400 eggs or ovum that will be ovulated in a woman's lifetime. Over the time, the ovarian follicles will degenerate and become less sensitive towards FSH and LH. Menopause then will occur once there is no more follicles left, as menstrual cycles do not take place. Next, the hormone level of the woman will also fluctuate upon reaching the menopause. To explain in more details about the hormone level of a woman when reaching menopause, here is a graph of the estrogen, GnRH, FSH, LH, and progesterone hormone against the age of a woman. Once reaching the perimenopause transition, an ovulatory menstrual cycle will occur due to the lack of FSH and LH. Along the way, estrogen and progesterone will also decrease. These will inhibit the hormonal reaction in the hypothalamus. This will trigger a negative feedback that will make the hypothalamus secrete more GnRH and the pituitary gland secrete more FSH and LH. The erratic secretion of hormone will cause hormonal irregulation. This will lead to symptoms of the menopause.
Next, we move to the signs and symptoms of menopause. Hot flash. Hot flash is a feeling of warmth that spreads over the body and more pronounced in the head and chest. It is produced by vasomotor disturbance and also can cause night sweats that leads to trouble sleeping. Vaginal dryness, which causes itching and dryness. The walls of the urethra, vaginal atrophy, and vaginal glands are no longer produce lubrication. Vaginal dryness happens due to the result in the thinning of the vaginal lining because of the estrogen level dropping. It is also can lead to dyspareunia, which is pain during sex. This could lead to a risk of urinary infections and causes a constant urge to urinate. When the level of estrogen is low, it could be result to complications like cardiovascular disease and osteoporosis. Tiredness, fatigue, mood changes, insomnia, thinning of hair or hair loss, weight gain in some women, reduced sex drive, and also sore or tender breasts are the symptoms that also could be happens. So, in conclusion, menopause refers to the natural halting of the monthly menstrual cycle, and this is because of the depletion of ovarian follicle. It is usually considered that a woman has entered menopause when more than 1 year has passed since her last menstrual period, and this usually happens around the age of 50, and it is preceded by a couple of years of hormonal changes.